But this is a story that's a local story, and it's very important to me, and I want to make sure that we discuss it, right? And I just came up on it last night. And so here, let me pull it up on my computer too so that we can...
I do love every now and again, because we didn't talk about this at all.
No.
It just happened. You're like, oh, you got that article too.
I found it late last night.
Yeah.
So the headline of this article is Military Cuts Insurance at Critically Needed Birthing Center in Paulsville. The name of this birthing center is True North Birthing Center. So read a little bit of this article and then we'll talk about it. Paulsville, Washington.
I don't have the actual article, apparently.
Oh, I'll send it to you. That's okay.
This is just a video.
I'll send it to you.
I was like, oh no, I grabbed the wrong tab. I hate when that happens, man. When modern day news sites just post a video of like the TV segment they did on it.
Yeah.
And like that's what they justify as their article.
There you go.
That bothers me. She's coming in hot.
Okay, so I will start reading this. This says the U.S. military's Tricare insurance is no longer covering services at Paulsbo's True North Birth Center, effective immediately in Kitsap County, where there is a critical shortage of birthing centers. And this is true, and I'll get into a little bit how I know that later. True North is a midwifery birthing center, an alternative to go to the hospital. The reason for the change is still unclear, but the agency now says it will only cover certified nurse midwives. The staff at True North are, quote, licensed midwives and certified professional midwives. So True North Birthing Center is a place that you can go, like I said, if you don't want to go to the hospital, where you can have your baby there. So you don't have to be induced. You don't have to get an epidural. There are a lot of women who do natural, right? So if you're going to do that and you don't want to go into a hospital, you can go into True North and you can have your baby and then leave the same day. Like that happens all the time. So women who want...
Because hospitals are due to probably regulation and insurance are
Yes.
this is the way we do it here. You might have limited options or whatever, but you're playing by their
They keep
playbook.
you to at least the next day. And if you leave before that, you have to sign an ADA, which is against doctors'
doctor's orders or whatever.
advice,
It's like,
against doctor's advice, where you're like acknowledging that if you fucking die, that's not their fault, you know? And so this is an alternative to that a lot of people will choose. They also do home births. I'm pretty sure they have like a pool there so that you can do like water births. They have all kinds of different stuff they do, right? So they have, and they have doula services and they have all kinds of stuff. True North is a really incredible
doulas
place.
are like the people that come over to your place and assist you?
Yeah,
or?
doula is like a support figure for the family.
Okay.
They're there
This is not my world. I come to you for this.
The doula is there to assist not only with like the generalized birthing process, but they're more focused on you and like things that you need. And so they'll also like they look out for the husbands and stuff like that too. You know, like if you need a break from like holding your wife, then they'll stand in and do that. You know, Aaron was with us when we did it, so we didn't have a doula. Aaron was there. So
she was the doula.
When
at that
I
point.
needed to take a break, Aaron would come stay with Jordan for a little bit. When I want to take a shower, like anything like that, if I needed to eat, you know, Aaron would come and hang out. So
nice.
So that is what a doula is.
That's a cool system, man.
It's very cool. It is a technicality that True North owner Ashley Jones said is costing people coverage. Quote, "We are licensed by the State Department of Health. This is the strictest state to become a licensed midwife in. Our education and clinical experience that are needed to become licensed is equivalent to certified nurse midwives." The
That's
company,
interesting.
yes, and that is true as far as what is required to be a midwife and the generalized regulations around having your baby here are very, very strict. So we had to have a home birth, right, with reason, and that's because with Dax, Jordan had a cesarean, she had a C-section. They call it a VBAC, a vaginal birth after cesarean. So they used to not let people do that because they're like, it's too dangerous, you're going to split, you know, where we cut into your abs and like all this type of stuff. So it's not that way anymore.
Okay.
If you are a healthy enough candidate, it's totally a thing that you can do. It happens all the time. Jordan did it, right, the second time around. Because of the way that this state goes, she had state insurance at the time. She couldn't have her baby in a birthing center and have a VBAC. She had to have it at home. So we could have the midwives, we could have True North do it, but we couldn't have it in a birthing center. For what reason? There is no reason at all. It's just, it's nonsense fucking regulation.
Yeah.
And this is what she's talking about, this is the type of stuff that they just stack onto stuff to make it more complicated. So I'm sure this is the type of thing that has led Tricare to be like, just fuck it. We don't want to deal with it. And Tricare is so strict about the way that they dole out healthcare. And if you have
military insurance,
and if you have a baby in a military hospital, they're so strict about the way that you have it done. They don't let you, you know, go past a certain point overdue. And there's all kinds. It's very, very regulated.
interesting for one of the most progressive states in the country, isn't it?
Isn't it?
It just kind of shows how authoritarian they are.
The company has had a contract with Tricare since 2018 because of the large military population in the area, but the insurance will no longer cover any new patients. Current patients, such as Brittany Ruiz, will still be covered. She is part of a Navy family that recently relocated to Kitsap County from Denver and is preparing to welcome a baby. It was a struggle finding a birthing center on such short notice under the military's Tricare insurance, and she feels fortunate to have found Paulsbo's True North Birthing Center. Because here I feel seen, I feel heard. It's me having a baby instead of a number on a chart, which is absolutely true.
Yeah.
Jones said there are only 8 obstetricians in the county, which is true, which amounts to 3 for every 100,000 people, which is true. In addition, the cancellation will likely put more pressure on hospitals in the area.
Okay, pause button. There's
That's
3?
8. 8 obstetricians in the county, which is
8.
amounts to 3 for every 100,000 people.
That is so little.
Right. Those are the people, for anyone who doesn't know, because
It's
it's
an
totally
OBG,
fine if
right?
you don't, OBGYN, obstetrician, those are the people who deliver babies. If you're in a hospital...
And
it's-
handle a number of other
Yes,
things.
that is who delivers baby. There are people, obviously, who can emergency deliver babies. But if you're going to have a baby and they know about it, they're going to be calling an obstetrician.
You got to get your OBG to get there, and he gets
Yes.
the call and shows up, and
Yes.
then bing, bang, boom. And
There's
there's
8.
fucking 8
Yes.
for...
This entire county.
That's insane. Because they're so busy doing everything else, too.
Yes, because they also do all of the general appointments for vaginas,
Yes.
all of the lady shit.
All
of
the
that,
lady part stuff.
All the lady stuff.
Yes.
They're doing all that. They're not just delivering babies. Yes.
Dude.
So to take away one of these options,
That's
It's bad
big,
news.
Huge.
yes.
Is that-
Because they also do, like at True North, they also do the first couple weeks of aftercare for the baby, so you don't have to go back into the hospital. You can go there. They'll do like the first 2 weeks, I think, of aftercare. You can go and re-see them as the mother for aftercare. There's all kinds of stuff they do that isn't just delivering your baby. That now you can't do any of that stuff there.
Yeah, because you're going to the doctor like for a month or two.
Oh, yeah.
Like very frequently after
Yes.
birth. Okay.
Yes.
And so way better to do that at the birthing center where, for one, they know you. Like they said, you're not a number on a chart. They were probably very involved in what you just went through and then all that good stuff. And then you don't have to go to the fucking hospital.
Yes.
Okay.
So the experience that we had with these people, right? Because like I said, this is who we had reason through, who Jordan had reason through. So we ended up having to have a home birth, and because reason came early, we had a different midwife because the on-call person like switches every week. So we had a different midwife than we had planned to, who Jordan hadn't really seen. So she didn't have a connection with this woman. She was still very, very friendly. She was still very warm with us. She did everything that she could, everything, until we got to the point that it was dangerous for reason and we needed to go to the hospital. At that point, we're still like the height of COVID stuff for
Oh, yeah.
hospitals and all this type of stuff. So the people in the ambulance tried to not allow me to ride with Jordan while she's mid-labor. She's
That's not
13
happening, dude.
hours into labor, and they're trying to tell me that I have to ride separately from her. So Melissa, I believe was her name, she vehemently advocated for me to ride in the ambulance and got to the point because it was just going to be Melissa and Jordan. Like I couldn't go at all. It was going to be the two of them. And Jordan doesn't like hospitals and like doctors, like any of that type of stuff, has severe anxiety.
Yeah.
And
this is not the midwife she's used to seeing all
Nope.
the time. So there's, oof,
exactly. And so
not a good, healthy,
no. So
stress-free
she
environment.
fought hard for us. And the people at Harrison tried to turn us away at first. They tried to tell us that we couldn't go there, that we needed to go to Gig Harbor because they didn't have enough beds there. So the point that we were at, right, we got to the point where Reason's life was literally in jeopardy. That's where we were at, that her blood was, to my understanding, like her blood was turning acidic. And so we were getting to the point that she would have died. If we had to drive to Gig Harbor, she would have died. Reason would not be here today if we drove to Gig Harbor. She would not have survived.
Dude.
They tried to turn us away, and so Melissa called multiple times and was like, I hear what you're saying, but like if we need to come in, we're gonna come in, you know? And they tried to turn us away and turn us away and turn us away, and she's like, no, we're coming in. I'm telling you now, we're coming to this hospital. You need to be prepared for us to get there.
I like this gal. I like this gal a lot.
Yes. And then I think even pushed back on the ambulance who tried to be like, I don't know if we can go there. She's like, oh, we're fucking going there. That's where we're going. We're going to St. Michael's. That's where we're going. Yeah. No,
Dude,
they
beast
were incredible.
mode.
They were incredible. And so the idea
That's so fucking cool.
that women are going to have more choices taken, families in general are going to have more choices taken away from them, and they're going to be pushed into a government-run center for them to pull your baby out of you, I find personally horrific.
And not to mention the extra cost that's going to be associated too.
1,000,000%.
So much too.
And it's
so much money.
a genuine disservice to
humanity
any of the
in
people
general.
who are serving in the military to fucking slap them in the face like this, to remove these choices when they already have such little choice. And I'm not like, poor military, you sign up for that. So like we've talked about that a bunch of times.
Yeah.
When you're a wife, when you're children, right? When you're trying to have your baby in the best circumstances possible, in the best environment possible, you don't need to be victimized by the fucking military because they don't like dealing with whatever.
The state.
Yeah.
It's the state's regulation is so fucking bad that even the military is going, we're just not going to deal with you anymore.
Yeah.
Sorry. That's how bad dude, I had no idea the depths of how fucking terrible that is.
Yes.
Oh, man.
So yeah, it's a real fucking tragedy that this is happening.
That's disgusting.
There's going to be a lot of ladies who receive inferior health care because they don't have options and they have to have their baby at a military hospital.
Well, I would assume that
Either that or
there's
pay out of pocket to go here.
You can go private practice at that point. You can just have to pay out of pocket, and I would imagine it'll still be a lot of money.
Oh,
but
yeah.
I'm sure it's much cheaper than.
We had to pay a certain amount out of pocket, because Jordan's insurance would only cover so much, and I think and this is not a hit at all in True North because their costs are what the costs are. They're not out there fucking raping people for money to get babies in the world, right?
The market is what it is.
The costs are what the costs are. But I think I think we had to only pay like 10% out of pocket. It was like $2,000 that we had to pay out of pocket through state insurance, So I don't. If you have to pay the whole thing out of pocket, you're talking about fucking 18 grand, some bullshit like that. Like I don't know. Yeah. I don't remember exactly because it wasn't 20. Like that's a crazy amount, but it was multiple thousands of dollars. Yeah. Because having a baby still like.
Yeah, because what's the average like? What is the insurance payout standard for like having a baby at a hospital? It's like 40 grand.
I think
right?
it's like 60 grand.
Doesn't surprise me.
Yeah,
especially with an overnight stay required.
You want to know something really cool though?
Go ahead.
St. Michael's is so fucked.
Yeah.
The whole system and everything is so fucked there.
Still.
That we never even got one bill. We didn't pay $1 for having our baby at the hospital, and the statute of limitations is gone now. They only have 90 days. They only have 90 days to bill anything medical. We never received one bill. We had a baby for no dollars in the hospital because they're such bags of shit and can't run a fucking hospital. Yeah. I think that was like right before all their shit got locked down.
Yes.
Yeah.
So, it was not long after when everything fucking they got hammed up by that fucking hack or whatever.
So we paid not a dime to the hospital. Paid True North. Happy to pay True North. They were incredible. Didn't pay a goddamn dime to the hospital.
And that woman put in fucking OT level work
awesome.
on that, man.
She
That's
was incredible.
insane.
She deserved every fucking penny that she got.
Amen.
Yeah.
Hopefully she got a raise after that. Because that's, dude. I'm going to go fucking fight with these hospital assholes real quick because we're having a fucking baby right now.
Compare that to the hospital when we were there, and I was trying to get us out there as fast as possible.
Yes.
And there's one of the human resources ladies that's trying to make me pick a doctor for reason off a list before we can leave, and she's like, "Well, you have to, if you just have to pick one off the list." Actually, I fucking don't. No. I'll take my wife and my baby out of this hospital right fucking now on an ADA. I don't give a fuck.
That's right.
Don't tell me what I have to do with my family. That's the difference there. From one woman who will literally call into the hospital, "No, we're coming now because you're going to save this woman's life and her baby," to an HR woman who's like, "No, you have to pick a doctor off of my approved list before I'll let you leave the hospital."
Kick rocks.
Yeah, get the fuck out of my face.
Yeah.
Fuck St. Michael's, True North all day.
Dude. Well, that's really sad, man.
It's really
tough.
sad. It's super fucking sad. I think they have some numbers at the bottom here for like what the costs are looking at. She said military families will now have to apply for Medicaid or pay out of pocket 40% of the babies born at her clinic are for military families. God damn. And moms may bear the brunt of child care's decision. 40%.
40%. And it makes sense
so
given
they're
the
also going to
population.
see a huge fucking loss in business.
Oh, yeah.
Because all these women who can't afford to pay whatever the cost is to pay out of pocket to go there.
Yep.
So their business is going to take a hit too. And it's an incredible place. It's a beautiful facility.
Yeah, they just had a nice remodel.
Yes, it's a beautiful facility. It's a great place.
That's tragic, man. That's fucking tragic. Hopefully they can still stay in business.
Yeah.
And at least be able to service some portion
I'm sure they will because it's such a fucking good place. But
yeah. But 40% is a tough loss.
Yeah.
I imagine it probably... I don't know, man, because the military don't pay like that, especially if you're on the younger end.
Right.
You're not.
We've
done stories about like military families being on fucking food stamps and stuff. I mean, I knew people that when I was in that were on WIC.
If you're fucking E1, E2, just regular ass enlisted.
Fucking E3s.
Yeah.
How about an E4 married with a
Right.
stay-at-home wife
Right.
and like 2 kids? That's all. Your money's gone and you're still. I mean, you're not living a lifestyle like you're pinching pennies, you're cutting coupons, you're doing the whole thing, and you're probably still on WIC.
Yeah.
And this should not exist like this.
No.
But I imagine some portion of that 40% will still go
I'm
or
sure.
whatever, but and just pay out of pocket.